All right, everyone. So we'll get started for today. And good afternoon, everyone, and thank you again for joining us today for the implications of COVID-19 on substance use and mental health, a public health perspective webinar. My name is Nina Salazar, and I'm the project coordinator for the Canadian Centre on Substance Use and Addiction. Before we get started, I'd like to also acknowledge that the land on which we gather is the unceded and unsurrendered territory of the Algonquin people. Before I introduce our moderator, I do want to note a few housekeeping items. Please note that all lines will be muted during this call to ensure sound quality. Please also note that the videos have been turned off, and we ask that you keep them off during the webinar. To view the panelist presentation without seeing other participants' videos, we recommend going to your video setting menu located at the bottom of the screen. And once you've selected video settings, a menu will pop up. Scroll down to the section called Meetings and click on the Hide Non-Video Participants button and close the menu to get back into the webinar. We will also be recording this webinar, and this will be posted on our website at ccsa.ca/webinars. If you experience any technical difficulties, please call TELUS Business Connect Meetings technical support at 1-844-626-6638. We are also live tweeting this event, so follow us at CCSA Canada and CCDUS Canada, and tweet along with us using the hashtag COVIDPHP. Now, please join me in welcome Rita Notarandrea, CEO of the Canadian Centre on Substance Use and Addiction, who will be moderating this panel discussion. Rita was appointed Chief Executive Officer of CCSA in July 2015. She works with all levels of government, as well as for the not-for-profit and private sectors, to ensure that addiction is recognized as a health condition requiring the same level of investment in full continuum of services and supports as other health conditions, and that collective efforts are galvanized to reduce alcohol and other drug-related harms on the health and safety of Canadians. Please welcome Rita. Rita, I apologize, you're in mute. There we go.
There we go. I wasn't unmuted. Someone else is controlling us. I just want to welcome everyone for joining us today. And I would like to give a warm welcome to our three expert panelists for really taking time out of your very demanding schedules, as we all know these days. I have worked with each of you, and it is always an absolute pleasure. So thank you. Thank you to Dr. Theresa Tam, Dr. Bonnie Henry, and Dr. Vera Etches. Your commitment and your leadership during these unprecedented times of a global pandemic has really been inspiring to all of us. We're all looking forward to your knowledge and your insights this afternoon in a very short period of time. You'll be happy to know that this webinar is completely sold out. And in fact, it was sold out maybe about 2 weeks ago. And we have quite a long list on a long waiting list. In fact, many of our webinars have been incredibly popular. And I have a sneaking suspicion it's because they've been an hour in length and we've packed in a lot of information, and really people are getting so much information that keeping it short has really been helpful. So thanks to the fantastic team at CCSA for organizing and for coming up with these wonderful ideas. This year, the pandemic has really impacted millions of lives, as we all know, not only in Canada and around the world. And in Canada, it has taken the lives of more than 9,000 people. These times are really challenging for each and every one of us, and it has created a lot of stress and anxiety for many Canadians on so many different levels. And in some cases, we've also seen that it's influencing their substance use. This pandemic has also presented additional challenges for the most vulnerable in our society, including people who use substances, people living with substance use disorders, and those with mental health issues. If you are struggling with a mental health or a substance use issue, you're not alone, and help is really available to you. The Government of Canada Wellness Together Canada portal is there as a first step, and I would encourage you to reach out to that portal. In fact, we could put the link in our chat box for those of you who are not yet familiar with it. In this panel discussion, our expert will provide federal, provincial, and local perspectives on the implications of COVID-19 for substance use and mental health in Canada. We're going to explore the impact of COVID-19 public health response measures and shine a spotlight on some of the lessons learned to date. We're also going to explore ways in which we can continue to support Canadians as pandemic restrictions across Canada change and as we prepare for potential future waves of COVID-19 infection. So we have quite an agenda before us, and I could go on about each of these panelists, but I'm going to keep the intros short so we can spend as much time as we can with each of you. But a quick introduction. Dr. Theresa Tam was named Canada's Chief Public Health Officer in June 26, 2017. She's a physician with expertise in immunization, infectious disease, emergency preparedness, and global health security. And during her 20 years in public health, she has played a leadership role in Canada's response to public health emergency, including SARS, H1N1, Ebola, and pretty much a lot of the issues we have dealt with. And so welcome, Dr. Tam. Our next panelist, Dr. Bonnie Henry, was appointed as British Columbia's Provincial Health Officer in February of 2018, after 3 years as the Deputy Provincial Health Officer. Before this, she has served as the Interim Provincial Executive Medical Director of the BC Centre for Disease Control and was the Medical Director of Communicable Disease Prevention and Control and Public Health Emergency Management with the Centre. In 2003, she was the operational lead in the response to the SARS outbreak in Toronto as well. Thank you for joining us, Dr. Henry. And our third panelist is Dr. Vera Etches, Medical Officer of Health in Ottawa Public Health since April of 2018. Dr. Vera Etches previously served as the Deputy Medical Officer of Health and Associate Medical Officer of Health in Ottawa. And as Associate Medical Officer of Health from 2009 to 2014, Dr. Etches was responsible for the management of teams that provided clinical services to prevent and treat sexually transmitted infections and blood-borne illnesses. Welcome, Dr. Vera Etches. All right, we're going to get started, and we have some questions to lead the discussion. And let me begin with our first, and that is COVID-19 pandemic is obviously having far-reaching impacts on public health. While in some cases it is worsening pre-existing health crises, it is also exposing a range of vulnerabilities and inequities that exist in Canada in our health and social sectors. In your opinion, how has the pandemic impacted substance use and those experiencing the harms of substance use, both among the general population and among the most vulnerable? And then, what has been the response in your jurisdictions to reduce some of these harms during the COVID pandemic? And where do you see some continuing challenges as well as opportunities? So how about if we start with Dr. Tam, followed by Dr. Henry, followed by Dr. Etches. Thank you. Theresa.
Hello, everyone. Can you hear me? Great. So, well, thank you, Rita and the CCSA, and really great thank you to my colleagues, Bonnie and Vera, for being on this panel. And I think, as Rita, you have said, you know, the COVID-19 pandemic has really shone a spotlight on some of the existing health inequities, but also on some of the ongoing health challenges. So it's where sort of non-communicable disease and communicable disease or infectious disease kind of collide on top of the existing, you know, equity, social determinants of health challenges that includes poverty, homelessness, stigma, that includes racism, and so many things that we knew in the public health community was something that existed and is pervasive in Canadian society. But, you know, put the COVID-19 on top of that, we've got some major challenges. So I think many of you have probably seen a range of surveys that has been done during the evolution of the epidemic in Canada that shows that many Canadians are using substances like alcohol, cannabis to cope really with stress and anxiety. And I think obviously it is expected that this is a very stressful event on many people. But, the surveys, including the nano survey, I think CCSA supported that one, conducted earlier on in the pandemic, sort of around March or so, that 25% of Canadians, 35 to 54, were drinking more while being at home due to the pandemic, and lack of regular schedule, stress, and boredom. And I think this is substantiated by a StatsCan survey that they've been conducting sort of over time as well, showing that, mid-March, 14% of people in Canada reported increased weekly consumption of alcohol, and a bit less in terms of tobacco, and 6% increased consumption of cannabis. And then that sort of carried on and a little tiny bit higher during the April, early May kind of time frame. And again, the lack of regular schedule was cited by about half of the participants of the survey, boredom by about half of them, and stress, with women actually more likely to report stress as a reason than men. And I think looking at sex and gender-based analysis and disaggregation of our data is very, very important. We know some of the distinct and disproportionate impact on women and racialized women, for example. And we don't have a lot of that kind of disaggregation, I think, in terms of substance use and mental health. I think, while many Canadians choose to use a number of these substances to cope, we don't really, this is a long journey, as we all know. We said this is a marathon. This is, we're still in it. There's many months. And so it's quite possible that these increased consumption can result in negative impacts on a whole range of life, home life, work, and interpersonal relationships. I think, with Rita, yourself, CCSA, we had discussed that awareness about the harms of alcohol use was pretty low, and people were not following the low-risk drinking guidelines even before the COVID-19 pandemic. And I think that, some of the, this may be exacerbated by the pandemic. But I think the biggest impact that is probably on people who have, say, an alcohol use disorder ahead of the pandemic that are at risk of returning to use alcohol due to stress, but also perhaps withdrawal symptoms and impacts due to disruption in supply that we need to pay attention to. I think, looking at what are the options, what can we tell people to do to try and cope in different ways than the consumption of a number of substances is really key. I think there's been some innovation that has occurred during the pandemic, including virtual care. And I think, I'm glad you mentioned the Wellness Together Canada portal, which was a significant investment. And I think brought together and try to sort of reduce this patchwork of different offerings across the country. And in order to support people at with different kinds of needs. And I think built in a way on a sort of step care approach. And we could talk about that in a little bit more later on. But I think providing an online portal, because people are told to stay at home, right? They're not sort of going out and sort of joining, going to a clinic or accessing care. There's a lot of stigma, as we all know, attached to mental health and substance use. And we found that maybe this online offering of different types of tools and services can sometimes help reduce that initial barrier for people accessing some of the care and connections that they need. So I think these virtual services, access anonymously, has some advantages, which I think we still have to evaluate, but I think it's at least something in bridging and offering some of these services for people in a more immediate way. And I think obviously the persons who use drugs and the opioid crisis, which has been a major public health challenge prior to the pandemic, has been exacerbating. Some of the gains that we've had in trying to reduce some of the impacts seem to have been reversed and maybe sort of getting worse, actually. So I think we'll get into that in a bit later. But I think from a sort of federal perspective, we know that some of the ways that we were able to maybe help include looking at flexibilities and regulations, looking at the production of guidance via some of the classic federal roles, providing some funding support to community-based organizations to work at from the sort of ground level up. But I think, you know, we should spend a little bit of time talking about how we provide more harm reduction services, safer drug supply, and other aspects. So I think, you know, we could certainly just, I'll leave it maybe at that to start, and then we can get into a little bit more on how we manage opioid crisis a little bit later on.
So I think I'm up next. I see that you're muted again, Rita. And I just want to say thank you for having me, and that I'm speaking to you from the traditional and unceded territories of the Lekwungen-speaking peoples here in Victoria, what we call Victoria, and the Songhees and Esquimalt First Nations, who are the traditional keepers of this land. I'm very grateful to be talking to you from here today. I am going to focus on what Theresa left off on, which is the overdose crisis. And as you know, here in BC, we've declared a public health emergency because of this rapid increase in numbers of young people, primarily young men, primarily dying from overdoses in our province. And as we headed into this pandemic, we took a number of measures to try and prevent transmission of COVID-19 into the populations, particularly of people who were street involved, who also had mental health and substance use issues, and we know many complex underlying chronic conditions as a result of homelessness and poverty. And as we moved through the pandemic response, it became apparent that we were not only losing ground, but we had our 3 months with the highest numbers of overdose deaths ever in our province. And the public health measures that we put in place to manage the pandemic exacerbated our overdose crises in ways that we had not foreseen. Particularly, it kept, the public health measures of keeping people at home, of reducing our numbers of contacts, meant that people who were couch surfing or staying with friends were suddenly homeless. We know that the loss of employment for many people meant that that increased our numbers of people who were living on the street or who were homeless. We also knew that access to shelters was reduced dramatically as we put in measures to try and protect people and protect them from the virus spreading in shelter situations, which again contributed to more people living on the streets and living in tent communities. We also know that people were not as able to access our overdose prevention supervised consumption services, became a very challenging issue across the province. And we also had interruptions in supports to people at food banks and other important social services in our community, where the workers in those settings were also feeling at risk from COVID, and the measures that we put in place made them very challenging to access. So we've had created a perfect storm in many ways to exacerbate the overdose crises. And the tragedy of what we were seeing was not only were the measures keeping people apart, but people who were using drugs who would normally use with a social group were now doing it alone at home, and in some cases tragically not being found for days because there was no expectation. They weren't going into work, people were working from home, and we had lost that social connection that many people had. But we still had that stigma and that shame around people who use drugs. So they were not reaching out to family or friends or others. And that increased our numbers of people, particularly young men who were using alone at home. And families said to me and to our coroner, that they didn't realize that they had relapsed, and the added stresses of the job situation, of people being concerned about how they we're going to manage was increasing people's substance use in general, as Theresa indicated. But now we had, on top of that, the measures we put in and borders in places meant that the toxicity of the drug supply on the streets went up exponentially as well. So not only did we have people who were isolated from others when normally they would have been using in a group, there was nobody there to save them when they overdosed on the toxic drugs that were flooding our communities. And not only where we've now started to see carfentanil and other opioid analogs in the heroin, so-called heroin supply, but we're also seeing cross-contamination of other drugs, like stimulants in particular, because they're being manufactured now onshore and in conditions that are even more perilous than what we were seeing being imported. And one other small piece for some people were having access to money through places like the CERB. And that meant that they, some of the drug dealing community were preying on people who had access to some money. So these were things that we did not anticipate, but that have really dramatically made our overdose crises worse here in BC. And we're trying to address those, and we'll talk about some of the things. So these are the challenges right now. The opportunity is we're recognizing this, and we've managed to push Health Canada to allow some exemptions that they've been that we've been trying to get for some time. I issued an order to allow healthcare providers other than physicians and nurse practitioners to prescribe pharmaceutical alternatives to street drugs to people, and we've started to roll out registered nurses and registered psychiatric nurses providing Suboxone and methadone to people. We're able now, with the changes that we've made under orders because of our dual emergencies here, to allow nurses to provide pharmaceutical alternatives directly to people. I think the other part that we are, of course, working on is around how do we reduce that stigma and encourage people to connect with with people that they know and that who are using drugs, and how to make sure we have an app that they can use, but ways to connect with people online to try and prevent them from dying. I'll just one other thing I'll add is that not only is the street drug supply becoming more toxic, it's mixed with other things, and we're now seeing benzodiazepines in a lot of the opioids as well, which means that it's more and more challenging to revive people if they are found in time, and that's meant increased use of naloxone, but also more hospitalizations for people and long-term downside impacts. So those are the wicked problems that we're faced with, and that we have unintentionally exacerbated with our response to COVID-19. And I'll turn it over to you, Vera.
Thank you. Yeah, it is the case that none of us have compared notes at what we would touch on today. Thank you for the opportunity to hear the different perspectives from the different levels of government, but you will hear, I think we will hear some common themes. There's no question, you hear the statistics at the federal level, the pan-Canadian level, about what the survey data is showing you. And for us, in the local level, in a city, on the ground, we do see and hear the stories behind those statistics from our work with partners and communities. So I will speak first about the general population and what we're seeing around substance use, and also to populations facing more disadvantage. So we do our own surveys locally to try to find out what's happening in our community and tailor our actions. What we found, is that people's coping strategies are being challenged. So just, we talk about some people turning to substance use more so. In fact, our information shows that for people who are struggling with mental health and well-being, that that use of alcohol has grown more than people who are reporting that their mental health and well-being is the same, or stable. What we see is actually parents who are reporting some of the highest levels of distress. This was back in June, so you can imagine it was a time when our schools were been closed for a while, childcare options often closed, and then as others have said, the populations with less advantage, so people who report being from a visible minority or having a disability, lower income, or unemployed. And unfortunately, we know that population of people who are unemployed has grown. So we've seen there's an increased demand for harm reduction services and counseling, and yet 1 in 3 people who indicated that they wanted to talk to someone about a mental health or substance use challenge, but they didn't know where to turn. And so our response, for the general population has been to promote alternative coping strategies, right? So not alcohol, or to clarify, what are the parameters, what are some of the hazards, when would you get into trouble with alcohol, and to promote alternative coping strategies to stay connected to others in virtual ways, and to promote access to service. So making sure that people do have a better understanding of where to turn, that there is help available. When it comes to populations more disadvantaged, we saw real challenges with everything shutting down for people with meeting some of the basic needs of life, like going to the washroom and being able to wash your hands, and some of the things that we promote in public health, and we just know that those were even barriers when people didn't have a home or somewhere to access. So one of the very important responses has been from the federal through provincial to local level, and recognition that we need to open up spaces and have more housing available. Certainly, some innovations for sure have been possible in terms of making use of hotels, and even an isolation center where we're able to build in harm reduction services and supervised consumption. I think those have been very important to protect lives here in Ottawa. Others spoke about the stigma of being able to access service and racism, and how we are hearing from populations that this is another layer, another challenge, that stigma related to COVID, sort of attached itself to homeless populations or other populations at higher risk. And yet, if you look at the accomplishments so far, there really hasn't been transmission of COVID in shelters in our area and many others, because of the efforts to provide more supports and enable more isolation and protection. So I will say it's been important to continue harm reduction services and the work of peers. So when we say peers, we mean drawing on the experience and expertise of people with lived and living experience to reach out to make sure that people do stay connected even when physically distanced, and so continuing the programs. We know, getting back to those basic needs, for access to food, people have had greater needs, greater difficulty. For example, if they're having to self-isolate, who can get your groceries and get your food? And so some of these things have been addressed through a human needs task force in Ottawa, but it's really uncovered quite a bit of food insecurity. So people who really are hungry very often. And so this is a new, I think a new area of focus that could be strengthened into the future, having had this experience and seeing what the need is out there. I think the reality is that there are some populations at higher risk for COVID, and so really a neighborhood level, a community level based response has been important to address the infection risk, but beyond that, to get to the root of social disadvantage that makes the risk higher when people don't have the ability to stay home if they're sick, or will lose income, or to be able to isolate in their homes when there's more of a crowded situation. So I think that that's the general picture of somehow how we're seeing COVID and substance use collide at the general population level, and for some communities with greater challenges. But I'm happy to speak more about opioids in a moment. Oh, I think you're on mute, Rita, again. Sorry.
I just unmuted. Can you hear me?
Yes.
All right. Thank you very much. You've all spoken about the whole idea behind this is to show the collective impact of the various governments and the various sectors and working together to address the pandemic. One of the issues that has come up is the response to the pandemic and the response to the opioid crisis. You know that that's come up, and people have done comparisons. So I asked this question from the perspective, is there anything that you've learned or anything from the pandemic and the response that we have given to the pandemic that could be applied to not only the opioid crisis or for future crises? Because before the pandemic, we were starting to look at meth, and we're saying, what did we learn, or what are we learning when we talk about opioids? Can we apply that to the meth and what's happening in some of the Western provinces? So I asked that question, is when you look at the responses that we have had collectively at the various jurisdictions, is there anything here that we can take and apply to the opioid crisis and to other crises? How about if we start with Bonnie on that one? Again, everyone has and then we'll go to Vera and then to Teresa. Is that all right?
Sure. Thank you. And, I think I get asked this quite a lot, how come we can't report daily on people who are dying from overdoses, and how come we can't move more quickly? And it is so challenging. And I do need to point out that it's not either or, that we are dealing with both of these crises right now. And the one thing that we have learned from the pandemic is that when we go work across silos and across government, we can make things change very, very quickly. And that has been a really important way that we have coordinated both provincially, locally, and nationally. So the coordinated response, and for me, that has been the opportunity to bring up some of these underlying inequities that have led to some of the challenges we've seen around the overdose crises as well, and to bring people along in responses that they may not have considered, or may not have considered as being part of their responsibility to understand and take action on prior to the pandemic. So particularly for health, we have a Ministry of Mental Health and Addictions, as well as a Ministry of Health here in British Columbia. And in some ways that has been a great benefit, but in some ways it's meant that the Ministry of Health can actually refer everything to the Ministry of Mental Health and Addictions, and we end up with a bit of a circle going on. So during this crisis, we very early on developed guidance so that we could support, for clinicians, clinical guidance to support people who were using drugs who needed to self-isolate, having access to managed alcohol, to pharmaceutical alternatives, to the street drugs, to methadone, to Suboxone, etc. And knowing that if people were either a close contact or were sick themselves and we needed to isolate them in hotels, as Vera was saying, we were doing very similar things here, that we would need to help them with their withdrawal as well. We've now recognized that, and this was sort of a huge step forward in being able to provide people with a safer supply, but it was a limited group of people, and clinicians were still concerned about that. As we've recognized the downside impacts that I talked about of our measures, and the risk that anybody who's using drugs have, now we've expanded those safer supply guidance to apply to anyone who is at risk of overdose death. And we've expanded the medications that will be available for pharmaceutical alternatives. We're mostly looking at hydromorphone. Now we're looking at medications like morphine and powdered morphine and injectable hydromorphone and fentanyl patches, and etc. So I think once people have recognized the need, it's made a difference. But I think the most important thing is the need for us to come together at a table that includes social services. We have a Ministry of Poverty Reduction where we look at things like food security, because it's not limited to the health impacts of what's going on. We need to look at how we're supporting people with disabilities who are also in that risk group and marginalized group. And we've had a table that's finally brought these people together to look at housing. How do we manage housing? We've ended up buying a huge, quite a few old motels that were empty, and now the province has bought them. But it's not just a place to live. That's important and incredibly important. But it's also having the mental health and the social supports built into those environments so that they don't become as risky as living on the street. I think the other thing that I'll talk about is the importance of our connecting with Indigenous communities and Indigenous leaders, and that has been a challenge and an advantage for us. We have a First Nations Health Authority that we've been working very closely with to support. We know that Indigenous people are differentially affected by the overdose crisis. We had been doing well in protecting them from, or working with them to protect community members from the COVID, but we're now seeing an increase in Indigenous peoples in BC. So, it's an ongoing issue that we need to work together. And when we talk about some of the challenges that have been laid to bear by the pandemic on top of everything, and the food insecurity, the absolute importance for many, many families of schools as a place where people get food, where they have access to mental health and health resources to support them, and where children grow not just from the education that they get, but from the interactions with their peers, with their colleagues. It may be the only place where they see diversity, and how important it is for us to take measures to keep our schools open for children, but for families and communities as well. And I'll leave it at that and turn it over to Vera.
Again, this is encouraging in itself that we share, the interest in advancing work in common areas, and so that is, as you said, Dr. Henry, one of the advantages of the lessons learned, I guess is what I'm trying to say, around how we can accomplish more. It is possible. We've seen rapid response, and in our experience at the local level, again here in a city, we created collectively 15 agencies to start, now 20 agencies, one coordinated point of access for mental health and substance use services. That's been a goal, an aspiration of many for a long time, but it happened very quickly now, and people saw the need. It's free, same day or next day support. Like, that's what people need. Free for sure, same day or next day. So this is definitely a lesson for the future. And others had mentioned the virtual care. So I think 75% of the thousands of people that have accessed that service now did so online, and 25% over the phone. So again, showing what can be possible. It's not going to work for everybody. So another lesson learned was the importance of mobile supports to populations who need face-to-face service. And so again, being able to quickly use mobile supports that were providing harm reduction service, access to health care, now adding in COVID assessment and testing, and bringing the services to where people are is an important lesson. I I will say, like Dr. Henry said, that there's also been rapid movement around safer supply, making sure that we decrease the risk of overdose with prescribed opioids. And so I think getting more buy-in for that, people seeing the risk. We do see our reported overdose and our emergency room visits have gone up this year from January. They're similar to the previous year's level, but it takes a while to get that information, sometimes the death information as well, but it also, people aren't making it to the emergency room always. And so the anecdotal reports, from people who run supervised consumption services and people who are first responders is definitely concerning. So again, no one agency can turn that around. And we have an overdose prevention and response task force with many different partners that are sharing that information for response in real time. I think that it's been mentioned, I don't want to be too repetitive, but just the importance of social connections and staying connected is a real lesson learned. It's so clearly important for health and to mitigate the risk of overdose. I think that finding ways to support one another and virtually and then with distance, emphasis on meeting outdoors, those kinds of things, continue to be important. I will say we agree that it's men 20 to 45 who are highest risk of death, and we need to overcome the stigma of reaching out for help. So some of the things in our community, we recognize Overdose Awareness Day and remember people who have been lost, to support each other. We also recognize Recovery Day and sharing the stories of people finding more well-being, finding more supports. I think are also important, that there is help out there and people can feel better. So those will be some of the lessons I've learned. I also want to say though, lastly, Ottawa has a community action plan with a focus on opioids. It's a mental health and substance use community action plan. Canadian Centre for Substance Use and Addictions is a member. They're focused on this strategy related to prevent stigma. So there's been a recognition that needs to continue. That work needs to continue. So a second focus is to decrease, to promote greater expansion of harm reduction approaches. And that's been strained. I want to note that the healthcare system had, the intention was to work on harm reduction approaches in hospital, in more facilities and settings where people seek support for substance use, and that hasn't advanced as quickly because hospitals are trying to do long-term care home supports, and they're trying to resume surgeries, and they're trying to run testing for COVID, and so there is too much pressure on the system in some ways to add in new things right now. And our public health team that would normally be that facilitator sometimes for uptake of health harm reduction approaches is also extremely stretched with the contact tracing and the outbreak management. So that's a reality. But then turning to where we can find efficiencies and easier ways of working together, that was the last aim of our community action plan, is more integrated services, better access, health and social services. And so again, just to say that people are connecting the health and the social services supports that people need more and more through this response. And I find that very hopeful.
Hi. I'm going to go next. Thanks. So I think it's probably a good thing that we're going to say a lot of common themes, but there's no doubt that I think, given the data, at least 7 jurisdictions sort of in Canada have seen this rise in the impact of opioid-related deaths and other harms. And so I think looking at the from the sort of federal perspective, I think adaptation, agility is one aspect of some of the response that we need to sort of capitalize on. You know, recognizing that no public health challenge is ever simple. They're very complex challenges that we're dealing with, and they do have unintended consequences when you try to respond to one thing. We need to be aware that we absolutely have to maintain other life-saving services at the same time. But I think from the federal perspective, I'm not from the regulatory area, but from the regulator, they've been quite flexible in providing some of the regulatory exemptions that Bonnie had mentioned to allow for flexibility of treatment options, like allowing prescribers to use verbal prescriptions for narcotics, which is, of course, very important if you're dealing with virtual continuation of care, and allowing pharmacists to extend and renew prescriptions. Trying to make it easier for provinces and territories to establish new temporary spaces. I think Vera mentioned some of them in existing supervised consumption sites and shelters or other temporary sites as needed. So getting that flexibility at the time of this crisis is very important. And while trying to get people to respect the physical distancing measures, I think our minister, the federal minister, recognized that even when these regulatory supports are there, many people actually don't know about them. So I think she wrote to regulatory bodies, obviously other ministers of health and others, to say, well, by the way, there's evidence that these harm reduction and safer supply measures work, and we now have the regulatory flexibility to expand safer drug supply, so that encouraging people to do it. It's actually not easy for health providers to actually shift the way they work. So I think making sure they know about the full spectrum of options is really important. I hope people have seen the sort of PRISM guidance, the tools that looking at how do we provide substance use related services, harm reduction services at the time of COVID-19, so that our frontline workers and health professionals feel that they can provide these services in as safe a way as possible. I mean, federal funding can be flexible, and certainly we've seen a lot of the federal funding support coming into play during this crisis. And I think Health Canada was able to redirect federal funding from the Substance Use and Addictions Program to support the immediate COVID-19 related needs. And that's sort of intersecting with the opioid crisis. They funded 10 projects, some of them in BC, Ontario, but also other provinces, I think New Brunswick, to provide the safer pharmaceutical grade medication. So some of these things we were trying to implement before COVID pandemic. I'm really happy that some of this actually did get going. Because it's really needed. I think in August, we were particularly pleased to see the Public Prosecution Service of Canada establish their new guidance for simple possession of controlled substance, which directs the prosecutors to focus on the most serious cases for prosecution. So, you know, trying to look at ways to reduce stigma and other harms through that channel as well. So I think, you know, in terms of lessons learned, always remember the unintended consequences, keep up with harm reduction, with safer drug supply is very, very important at the same time as trying to manage the pandemic. But I think I really agree with Bonnie and Vera that what I've seen in terms of collaboration, I've never seen before. I mean, I can now talk to a whole suite of ministers at the same time who are looking at social policies, housing, education, or other, really key determinants of health, really, and have taken any opportunity we can to stress that those are the underpinnings and foundations of enhancing the health of our population. So I think we must not let go of the momentum that has been gained, so that, for example, some of the housing supports is sort of continues in, and past the pandemic itself. I also feel that public health has been raised in the public health system itself in terms of profile, where, we're always like under the radar. Like everybody now knows about public health, and that we again need to sort of use this opportunity to gain capacities in order to help our population. but also we are the connects to some of these other sectors and making visible some of these health inequities. And so I think the conversation has now entered the media, for example, and some of these mainstream discourse. So we just have to just keep going and build on this work. Thank you.
Thank you very much. We have 10 minutes left. The last question is, you've all touched on the impact that the pandemic has had on the mental health of Canadians, as well as their substance use. Therefore, if we look for the next 4 months, and you'll have to be short so that we can hear from all of you, in the next 4 months, as we prepare, and in fact we are preparing, what would be the 1 to 2 things that we ought to be putting into place as we prepare for and mitigate the risks of the next wave? And please keep it short so we can hear from all of you. Now, it's been 3 questions. You each had a turn to go first. Vera, you're the last. We'll go first with you, then to Teresa, and we'll end it off with Bonnie, if that's okay. Over to you.
Well, I think one of the important things is that we don't just talk about the infectious disease COVID-19, but we talk about the well-being of our population and what are all of the elements that we need to use and have in place to think about the overall health of the population. So one of my counselors in Ottawa said it should be, every time you talk about masks, talk about mental health, you know, that they go hand in hand together. That we learned, for example, if you know, the parents are reporting this high level of stress, we must keep schools open. We must have that as one of the pandemic goals. You know, and that helps again with the economic pressures around people being able to work and the harms of not having employment on the population's health. So I think that's important in the next few months. I'd also underline that prevention is important. So when we're talking about you know, COVID infection, it's hard to catch up with trying to find the virus and trace it. You know, it's much more effective to slow the pandemic by preventing transmission. And there are the harms if people are too distant from each other, but it is the number of close contacts that we have that leads to transmission. And so I would say a lesson learned for me to focus as we go forward, and we might have to be more strict about the number of close contacts, is to emphasize it's not about just stay home and just your household. It can't be that, given the harm we've seen from isolation. Everybody needs an essential social support. So if you're a single parent or a single adult you know, at greater risk of overdose, you need to have somebody else connected to you, even as we reduce our close contacts. Certainly, we need to work with communities who are facing the greatest risks and harms on both fronts, and that is a priority. Again, the community level work with neighborhoods, leaders, peers, this is very important. And when it comes to prevention, I think also being able to turn to youth and think about what role can youth play who are feeling the brunt of the COVID pandemic to help involve youth in initiatives and you know, engage them in activities that help you know, as an alternative coping strategy from substances. Really, that also we want to keep an eye on the next generations when it comes to thinking about substance use, but also getting through this pandemic. Those probably took long enough there. Sorry. Stop.
Yes, hi. So I think you know, in terms of mental health and resilience, you know, again, we've been just tracking self-rated mental health throughout the pandemic, and quite a number of surveys have shown that mental health has worsened for some Canadians. And again, those with the social capital to weather the storm do better and others don't. So I think recognizing that, you know, these other supports are extremely important, so the financial, social, and other supports. And that absolutely, that physical distancing, but socially connected, so that those with families, friends, strong community ties, how to support that, and the financial means to help people do it, so that they're more likely to fare well during the pandemic and have these built-in support systems. I think we need to create the prevention side, building that mental health resilience for children and youth. I think Vera just mentioned that, and that they don't ever underestimate the impact on their mental health. And so that prevention piece and this early childhood, I mean, remembering that some of the kids are actually going through this as part of their early childhood experience. And so we need to be mindful of that. And the negative impact on populations. And I think we could focus on NGOs and other support for people with low income, youth, seniors, LGBTQ2 plus youth, racialized populations, Black Canadians and Indigenous populations, and their systemic barriers. I think, you know, the support for the responders too, I think, from mental health. So the health professionals, the first responders, essential workers, those who work in the essential services, many of them are racialized women. How do we provide the more tailored response? The public health system, quite frankly, I look around at my colleagues, everyone is exhausted and need that professional help. I think, you know, I keep reminding colleagues to actually, by the way, these services are also for you. Log on to Wellness Together Canada and other, you know, services, because we cannot sort of forget our own mental health, that we're trying to help others, but we're really, some of our systems are at the edge of coping, and our contact traces, our laboratories. So, you know, I think that's really key as we so go ahead in terms of help for the responders and the health system as well. I am kind of keen on the virtual and digital tools. I know the federal government invested quite a bit in this, and we have to learn and evaluate them. But so far from what I've seen, trying to promote the use has been, you know, yielded quite a lot of benefits. So I think I'm also looking forward to see how we capitalize this. But I think the data coming out from many of these portals like Kids Help Phone and other services gives us an insight into what is actually going on, so that we can leverage those kind of data to inform our action. But, you know, in the end, it is about connection. It's about maintaining social connection. Just as we keep saying, wash our hands and all these other public health measures, keep reminding people, by the way, carry naloxone and do all these other things that we keep trying to tell people to do prior to the pandemic as it relates to substance use. You know, we have to just keep reminding people as well. And so I think maybe I'll stop there.
Right. I'll be very quick, because I absolutely agree with what you have said. And I've said many times that I think one of the things we've learned is the analogy I use is we're all in the same storm, and really globally we are all in the same storm, but we're not all in the same boat. And recognizing that we need to build connection, we need to have compassion and community, and that's what builds resilience and will get us through this. And you know, my mantra has been, you know, that we need to be kind, because that is how we understand that others, we need to be calm and recognize that we don't always know where somebody is coming from and what their story is. And we need that to stay safe, because if we're all doing that, we can all be safe together. And we also need hope. And hope is, this is not forever, but it is for now.
I'm unmuted. Thank you so much. What a wonderful way to end this 1 hour that went very, very quickly. So I want to thank Drs. Tam, Henry, and Etches for taking time out of a demanding schedule. I really appreciate it, and all 500 people on this call and in Canada really value your commitment in protecting Canadians during these difficult times. And I'd like to end on what you said, Bonnie, in terms of we all have a responsibility, and we all have to, well, we're all connected and we're all touched by this. So I think in our own communities, we have to look at ways to connect people to the services that they need in a timely way. And I want to repeat that for information and resources, there is the government website, there is Wellness Together Canada, there is a hub on CCSA's website in terms of documents on substance use, and the Mental Health Commission of Canada also has a hub on mental health related resources. So for everyone that joined us today, thank you so much for the 1 hour you gave us, and I hope you're walking away with some insight from all of you. So thank you so much. Take care. Stay well.